This is the Emergency Medical Minute, sponsored by Health One.
Okay, so at the request of Steve, we're going to talk about lung injury and ARDS, which, what does ARDS stand for? Acute Respiratory Distress Syndrome. And what causes ARDS? Coronavirus is one of the things, right? So it could be infectious, but the answer is a buttload of things cause it, right? So it could be infectious, it could be toxic if you inhale something, you see it sometimes after really bad burns. So the differential for it is very, very long, okay? So ARDS is kind of this catch-all thing where the lungs are injured and they start filling with fluid. And what does that look like on X-ray? It looks like white, and it's on both sides, right? So part of the diagnostic criteria is it's not just a lobar or one lobe is affected, is you see a lot of white crap on both sides of the lungs, okay? And now part of the other diagnostic criteria is you have to exclude what entity? Pneumonia is an important thing, yeah, but and pneumonia can sometimes progress or cause ARDS. But the other thing that gives you water on both sides of your lungs is CHF, so a bad heart, right? So we have to make sure that your heart's pumping well and that you don't have actually just bilateral pulmonary edema related to a bad heart, okay? So ARDS is something that we'll often see in the emergency department and we'll often start treating empirically. There's a few pitfalls for ARDS that you have to think about. One is coronavirus. Just kidding. We have to, of course, right now, coronavirus for everything. But anyways, one thing that you have to think about is if these patients progress and you actually have to intubate them, there's a few important things that you have to do. And does anyone know what the important thing when you intubate them is? Suction. Okay. Now, so suction, yes, it's a normal intubation. But after you intubate them, what do you have to do? Yes. So the thing that you gets people into trouble when you intubate them, and thankfully we have respiratory therapists here, but if you intubate them and then you just try to get their oxygen really high up, you'll oftentimes turn up their pressure and you'll turn up the oxygen, and oftentimes you'll do a lot more harm than good. Because if you actually increase their peak plateaus and you increase kind of the inspiratory and expiratory barotrauma, people do much, much worse. So there's this whole concept, and this all happened, I think, back in the early 2000s, where they started intubating people with ARDS, and they have basically permissive hypoxia and really low tidal volumes and really low peak pressures. And people do much better when you actually do that, because that lung is already injured, and if you're trying to just flog that lung to get your oxygen up, you're going to end up doing a lot more harm than good for that patient's long-term course. So oftentimes you'll intubate them, you'll let them hang out with a oxygen level in the 80s, as long as your pressures aren't too high. There's a few interesting things that Steve kind of mentioned, which sometimes when you go upstairs and you're in the ICU, they'll start flipping patients kind of to their front and to the back to make them prone and otherwise. And that's just all about trying to match your VQ, so match the perfusion to where you actually have good lungs. And then if ARDS continues to progress, what's the final thing that all these patients get? ECMO, right? ECMO is basically lungs when you don't have them. So a lot of these patients progress to ECMO. Okay. Last piece of trivia. What does Corona stand for? Corona? What does it stand for? Corona is a Mexican beer. But why do they put that in the Mexican beer commercials? Why do they take that and put it up? It stands for crown, right? Or sun, you know? So oftentimes when you look at the coronavirus and it has all these things, it means crown or sun. Okay? So yay. Okay.
We are on a quest to provide the world with free medical education. Please help us out by rating us on iTunes, following us on social media, and subscribing to our newsletter at emergencymedicalminute.com.